Hi, this is Shterna Hershkowitz. I'm going to do my case study. So this is about a boy who's 12 years old and he is diagnosed with cerebral palsy. He was actually born early, 8 months at gestation. So his family history, he lives with his mother, his father, his sister, and they live in an apartment building, and he got cerebral palsy the most common way because he had lack of oxygen during his mother's labor while he was being delivered. So the symptoms he has are that he has increased muscle spasticity. He has contractions on his elbow, wrist, knee, hands, and his gait is very unsteady, and he has an irregular posture, which are all very common symptoms seen in a child with cerebral palsy. He can talk, and he is cognitively aware of what's going on around him, but it's really his physical limitations that have delayed him. So for the evaluation, we used passive and active range of motion. We saw how he was able to move. We tested his muscle strength. We also had an interview process with the parents. And then we also used the Brunstrom chart to evaluate how spastic his muscles were. And then we also looked at his chart, and we just observed how he was acting and how he was moving. So his problems are that he had decreased passive and active range of motion. He has multiple contractures. Those were being taken care of with splints that were already fabricated for him. Due to all of these limitations, he had decreased activities of daily living. He was unable to take care of himself well. And he was also unable to, he had big problems and difficulties with with moving around, transferring, and then getting around functionally. So the treatment we used, it was only half-hour sessions, and we would do passive range of motion. We would range him. We would work on fine motor strengthening, and then we also worked on increasing his core strength so that he would be able to improve his posture and his movements, because we always start proximal and move distal. And then we also wanted to increase his endurance and his standing tolerance, and we worked on transferring, functionally to the toilet, to his walker, and different things like that. So the splints, we did not fabricate any for him. He had them already due to his contractures. So the interventions we used were we did aquatic therapy. That was what our facility had, so that was really good for him. He really enjoyed it, and we were able to range him in the water so that he was able to move his fingers much easier, and it was a lot less painful. We also did range him out of the water so that we can increase his passive range of motion. And then we also had him practice with functional things such as transfers. We taught him some adaptive equipment that he can use, and we also used I taught him strategies, for him to improve his dressing and his ADL. So we work with different buttons and zippers, and different ways that he can dress easier independently. So the home exercise program, I taught the caregiver how to range him, so that, because sometimes he would come to the facility and he was really, really stiff, and we couldn't move him very well, and he was in a lot of pain. So we would have the caregiver, and we also taught himself that he can range himself so that he won't be so stiff, and he'll have a lot more movement, and it won't be so painful. And we did this so that we can decrease his chance of getting more contractures, and we also wanted to help preserve the joints and the muscles. And we wanted to increase his active and passive range of motion. So the discharge program, there was none, because our facility is outpatient and it's continuous. Unless he would lose his insurance, he would keep going there. People have been going there for years. So the research article I looked at was the effects of hyperbaric oxygen therapy, which is basically you put the patient in a room and there's 3 times as much of high levels of oxygen, which is three times as much as regular, to try to help with recovery. And they did see improvements, that it's worth it to start trying and to use it. And it really does promote. We can look, okay, So basically the study is that they wanted to see improvement in gross motor function, fine motor function, spasticity, and they also they had a questionnaire for the parents to see how they're functioning, regularly with their activities of daily living. And so they actually stopped OT and PT services, and they had the patients just go to the this hyperbaric oxygen therapy room, where they would just have that oxygen, the 3 times as much oxygen. And they saw that there actually there was improvement in the fine and gross motor function. They saw that there was decreased spasticity, and they also saw that the parental questionnaire did say that the child was doing better in their ADLs. So it's very important for us to know this, because if they're decreasing spasticity and they're increasing their ADLs and they're increasing their fine and gross motor skills, that means that when they're doing their actual therapy, they're going to actually get better, and they're actually going to be able to improve into those everyday activities that are very meaningful to them. So this is definitely an intervention that would be something to use and to look at and see if the patient was a good candidate for this therapy. Thank you. This is Shterna Hershkowitz.